Can vitamin D be used as a joint supplement for better joint health? Can it be used to treat things like arthritis, disc issues, meniscus tears, other cartilage damage, and bone-on-bone joint situations? Did you know that half of the world's population is estimated to be insufficient in their vitamin D? In this video, I'll teach you about vitamin D so that you can see if it's right for you to use this as a health supplement. Vitamin D is very important for muscle function and bone development. Those are probably the two most common things that vitamin D is considered for, especially if you have something like osteoporosis going on. But it's also tied in with mood and depression. We know in research that if you are depressed, upping your vitamin D tends to show an improvement in your depression levels and your overall positive mood. But it's even been shown to slow down cancer growth and help fight against infections in your body. And in some studies, it's even been shown to reduce inflammation throughout your whole body, which is what I'm more concerned about because I help people with arthritis problems all the time, and I want their joint inflammation, that's what arthritis means, to go down as much as possible so that they can get back their mobility and get back to being normal again. So that's where I think vitamin D might play a huge role for your joint health. Now, what are the possible side effects or downsides of taking vitamin D? Well, as always, some people have allergic reactions to specific vitamin D. And just so you know more about vitamin D, our body can create vitamin D with sunlight on our skin, but not everybody is in a place where they get a lot of sunlight, or they might be indoors, or they may be covered up and they may not access much of their skin to the sunlight so that they can get the vitamin D that they need for their everyday use. So I just want to make sure I let you know about how we normally get vitamin D, because this is synthetic vitamin D. Of course, this is man-made, but it is very beneficial. And you might also have the question of why vitamin D3? There's other ones, there's D1 and D2, and D3 is known to be best absorbed by the body. So that's why vitamin D3. But anyways, you might have an allergic reaction to synthetic vitamin D, so watch out for that. Common symptoms or side effects will be like nausea and vomiting, a loss of appetite. Prolonged use can cause a decrease in weight if you have a long enough loss of appetite. Of course, if you're pregnant or nursing, you need to consult with your doctor so that you can make sure that this is right for your baby as well. Now, I did see in one study that taking more than 4,000 IU is the unit of how they measure this. There's micrograms and then IU. IU is more standard for vitamins. Taking more than 4,000 IU could potentially be harmful for children under 9 or 10 years old. But for adults, the only limitation that I saw was more than 60,000 IU, which is a lot of these pills here. And if you're taking it daily for months, for like 3 months or more, then there's an associated risk of toxicity, which then you might get those side effects. So, it's really a long shot to overdose and get to toxicity with vitamin D, possibly with children, but you'll have to talk to your children's doctor to make sure that if you need a supplement with vitamin D, what dosage to take. Now, there isn't a clear, defined a guideline as to what's the right dosage of vitamin D, so you really should consult your doctor. And if you're not going to consult your doctor, then you should consider getting some blood work, which might require you talking to the doctor anyway, just to see that your blood values are okay, and you can monitor any changes as you take vitamin D, because it can affect your calcium levels in your blood, which can be problematic if you have too much calcium in your blood. Now, let me tell you my honest opinion about vitamin D. I think that you should be taking this. I mean, with half the world's population potentially not having enough vitamin D, it's a no-brainer. And especially if you tend to be an indoors person, or you cover yourself up, you're protecting yourself from the sun a lot, then you need to make sure that you're supplementing with vitamin D somehow. Now, I really like Solgar's vitamin D. This brand, Solgar, I've made other videos with them. They don't pay me to do this. I just like Solgar because of how they package their stuff and the process they go through to get their vitamins so pure. You can see down here it says non-GMO, gluten, wheat, and dairy-free as well. And they use vegetable capsules rather than other synthetic stuff, so that's really cool. And then they use these amber glass bottles. You typically see vitamins stored in plastic bottles, and I prefer glass over plastic 100%. It's not always doable, but Solgar does it, so that's what I get. Now, if you're trying to create the best environment for your joint problems to heal, especially something like osteoarthritis, then having enough vitamin D to make sure that your muscles are functioning well and your bones are as healthy as can be is a no-brainer. You need to be taking this. Now, you can't rely on just taking vitamin D alone and expect your arthritis symptoms to improve. This is just one tiny piece of the whole picture. You need to make sure that you're working on the mechanical side of things, that the rest of your diet and other supplements you might be taking, you need to consider all those factors. But if you're asking yourself questions about whether or not you should take vitamin D, I think the risks are quite low. You need to take a heck of a lot, like more than anybody would normally take, in order to run into any problems. This just is going to benefit your health. So how to take this? Now here on the bottle it says to take 1 capsule per day. You want to take this with the meal just to make sure that it's absorbed okay and you don't have any stomach problems from just taking a vitamin alone. And they're not huge pills. You can see them there. So they're pretty easy going down. And you can take up, I think you could take up to 2 or 3 of these. What I would recommend though, if you're going to take more than 1, is do the blood work. Get some blood work done so you have a baseline of where you stand right now. Talk to your doctor, and then as you take 1 pill for 2 to 4 weeks, do blood work again before you increase to 2 pills, and maybe even increase to 3 pills after you do some more blood work, and make sure that you're healthy and you're okay and that it's actually benefiting you and not making things worse. Now, if you're taking 1 of these a day, there's 240 capsules here in this jar, so this will last you months. If you're taking 2 a day, it'll still last you a few months. So 1 of these bottles should be enough for you to determine if it's going to be beneficial for you, because you should be taking this for at least 2 months in order to determine if it's going to be helpful for you. Of course, if you're getting your blood work drawn and you're looking at those values, you'll be able to see much more quickly if it's helping you out. But you can better assess how your joints feel after a couple of months of taking this, and that's not something that can be measured through your blood work. You'll have to look at how well you walk, how easy it is to get up and down. Wherever you were having problems, go back and think about those things so that you can make sure to check them after you've been taking vitamin D for 2 months. If you want to get this exact type of vitamin from Solgar, I've put a link in the description below to order it from Amazon. That's where I get my Solgar from. So you can go check that out. If you use our link, you'll be helping out our channel. I hope you liked this video. If you did, give it a thumbs up and share this with somebody that you want to inform about vitamin D so they can know how it might help their joints. Thanks so much, and I'll catch you in the next video. Bye-bye.